Safe patient care is a priority for all of us, whether we are a didactic faculty colleague or we are a clinical faculty colleague. We want to make sure that students, when they get to the bedside, as they're providing safe patient care, they understand the why. We don't want students just doing well on an exam, passing the NCLEX, and then when they get to our clinical partner, they have a lot of gaps, right? We want to identify those gaps early so we can then partner with our students to identify what interventions are necessary to help them be successful and ultimately to provide safer patient care to our community members. Welcome back, everybody, to Dr. Sellars Educate. We're happy that you're back. Now, before we get started, we want to make sure you have your resources, okay? So we're all about application here at Dr. Sellars Educate. So first, you want to have Billings and Halstead Teaching and Nursing. This is the 6th edition that we're holding right now, but if you have the 7th edition, that's great as well. We're going to be referencing page numbers to help you close your knowledge gaps as you're moving forward on your journey to achieve CNE, to become a better nurse educator, or to become a better nurse. We love seeing all different colleagues, nurse colleagues here on our channel. And then the second step we want you to take is to print out the study worksheet. That's going to help you stay focused as we hone in on content that's going to help you get better, hopefully at least 1% better every day. That's the goal for all of us. If you haven't already, we want you to make sure, and I'll go ahead and write this down as well, you email us with any questions that you have. Okay, so info@drsellarseducate.com. You can also look at all of the resources that we have available to you on our website, drsellarseducate.com. We don't want you to struggle as you're moving forward on your journey as a nurse educator. We want to provide a community that will be supportive of whatever challenge you have or whatever celebration you want to share. We are a community of nurse educator colleagues that are here to support each other on the journey. We are accredited, and we want to make sure that we get that message out as often as we can. We became accredited in 2025 by ANCC. So what that means to you is that not only does it require us to meet specific international standards to ensure we're providing quality program for you, it also helps you meet your requirement by your Board of Nursing or by your accrediting body if you are certified, to help ensure that you are aligning your practice, the decisions you're making as an educator or as a nurse, with what the evidence says, right? That's the purpose of continuing education. Malcolm Knowles is a pioneer in the learning theory diagram on page or in table 14.1, and your page numbers may vary depending if you have the 6th edition or the 7th edition, but Malcolm Knowles talks about the commitment that we make as an educator to be a lifelong learner. Now, being an educator isn't just about a title. All of us as nurses are educators, right? We're constantly sharing information with our community, with our colleagues to help understand a disease process or a medication or a treatment plan. So in this snapshot, we're talking about competency-based, why it's so important and how it really does change the landscape. I may be a little bit biased because I've done quite a bit of work related to competency-based education. I've seen firsthand the impact it can have on truly transforming how a nurse thinks about the care that they are delivering. It's not just about validating knowledge on an exam. We have to validate the actual demonstration of those skills, okay? And there's many ways we can do that. It's not only by demonstration, it's also about being able to engage in those unfolding case studies, the case-based learning that we know is essential. So we're talking about a really important question. Why competency-based teaching changes everything, or does it? Does it change everything or not? Oftentimes, just like this picture shows, our students spend quite a bit of time on their laptop, right, on their devices. And this is where they're going to find most of their information to help them bridge those knowledge gaps, right, to close the loop related to concepts that are going to help them make those safe patient care decisions. So this is what we must remember as we're helping students really engage in those 4 phases of learning that David Cope talks about, and that's what we're going to hone in on today. We want to make sure that students are not only using a screen to help them comprehend. There's a human element that we all must engage in with our students in order to validate that nursing has happened. I would venture to guess about 60% of the content that students need to know about is what we discuss during our in-person class time, right? There's so much more content that students need to dig deeply into so that they can truly have that level of application that we need them to, and ultimately get into that highest form of the cognitive learning domain, which is creation, right? So we want students to be able to have that deep comprehension of concepts so that they can make safe patient care decisions, and that requires a human connection. All right, so David Cope, experiential learning theory, is what we're aligning with our conversation today. So what does David Cope really have to do with nursing care, specific safe patient care? Well, I want you to take a look in Billings and Halstead. This is the 6th edition, pages 30 through 31, but starting on page 30 is where you're going to see a really good explanation of the David Cope model. Figure 2.2, if you're like me and you're a visual learner, that's going to help you really have a visual understanding of the concepts that we're getting ready to explore. And I was intentional in not showing you a diagram first, but I am getting ready to show you a diagram. So go ahead and write some of the key elements down that I've already discussed. Okay, so on that study worksheet every single week, and this is for colleagues that are on the journey and those that have already achieved CNE, you want to make sure you're clear about the objective that you are going to achieve by the end of our time together today. So we've shared what we're talking about today, right? Focusing on competency-based, how it really aligns with the decisions that we want students to make about providing safe patient care. And then we aligned it with learning theory. David Cope, table 14.1 is where you're going to go, but also you're going to take a look, pages 30 and 31, that will go deeper into helping you comprehend what David Cope's theory is really all about. Okay, so I didn't show you the diagram yet because I wanted to decrease as much as I could the cognitive overload that so many of us feel as we're moving forward on the journey to get 1% better every day. The reason why we have so much cognitive overload is because there are, let's just estimate, 600 pages in this textbook. So for some colleagues, when you hear that, oh, you got to use Billings and Halstead to close your knowledge gaps and to make sure that you are aligning the evidence-based practices that you're using every day with what the evidence says. Okay, so we may be following a practice that we've used in the classroom for 5 years. However, it may not be relevant anymore. It may not be the best way to help our students learn. Okay, so I intentionally did not show you this diagram until now. Okay, so this is about gaps. That's the conversation we want you to have at this point. What are your gaps? So you can see on the screen, for those of you that are listening on our podcast, or if you're just listening to the audio part, you definitely want to come back and take a look at this diagram. David Cope says there's 4 phases. Okay, so there's 4 phases associated with the learning process. And students move through each phase based on the coaching, the support, the facilitation that we guide them through as they move forward through these 4 phases. And sometimes students can get stuck. The other point I want you to make that you want to take away today is that you have to start, his theory says, David Cope theory says, we don't start learning until we have that concrete experience, which is described as doing or having an actual experience, okay? And I don't want you to go any further, okay? So I just want you to think about where your gaps are as it relates to these 4 phases. We'll pick up during our next snapshot to talk more about David Cope's model. Okay, so these are the 3 questions I want you to think about. I want you to reflect on your specific teaching strategies you're using right now. So just pick one class. I want you to think about what teaching strategy are you using? The next question I want you to think about is why. Why are you using that teaching strategy? One good example is going to be lectures. Okay, so what strategy are you using to facilitate learning? Lecture. That's very common. And then why? Why are you using lecture? And then how? How does the content in our lecture align with our learning objectives, align with the curriculum, align with the program outcomes, right? We want to make sure there's strong alignment. So how? How does that teaching strategy actually align? And then the second important question related to the how is, how do we know students are learning the concepts that we have mapped to the exam, to our teaching strategy, to the content that we are exploring during our discussions in class. Remember, only about 60%, I would estimate, of the content that we're discussing with our students in class are really the minimum standards or the minimum content that they need to explore, right? There's at least 40% more content that they have to explore independently. And then we want them to bring the questions to class. We want students to engage in the active learning process that we know all of them are capable of. One other point I want to make is when it comes to those 4 phases of learning that we just looked at related to David Cope, that you're going to go back and look at on page 30. There's a great diagram, again, figure 2.2. The other point I want you to take away from this time together is there are 2 directions associated with David Cope's model. So his work says abstract to concrete. Okay, so that's one direction. The next direction is going to be active to reflective, right? So students are able to engage in active learning through hands-on experience as an example, right? Or concrete, that's theory. That's a conversation we're having with our students, and Patricia Benner's work talks about our ability to truly bridge that theory practice gap by bringing to life the concepts that we're teaching in the classroom is a great way to engage in clinical judgment and active learning with our students. Okay, so when we're able to provide that concrete experience through active learning, we're able to bridge that theory gap a whole lot quicker, that theory practice gap a whole lot quicker, because students are able to bring together this diagram. When you look at it on figure 2.2, you'll see what I'm describing. They'll be able to truly segue those 2 parallels as it relates to the learning journey, right? We know oftentimes students do learn in a parallel, but we want there to be cross-functional learning too, and that's what David Cope talks about in his work. All right, so as we wrap up our time together, let's take a look at this thought-provoking question. Now, certainly you all didn't think I would forget about the thought-provoking question, because I know so many colleagues ask us about that. Can I have more practice questions? Well, this is what we want you to do. We want you to focus on these thought-provoking questions and go a little bit deeper as part of your debrief at the end of our time together in the snapshot. A nursing program reports strong student engagement, high course pass rates, and consistent content coverage across the curriculum. However, faculty note that during simulation and capstone experiences, students struggle to prioritize care, adapt to changing patient conditions, and justify clinical decisions. In response, leadership is debating a shift toward competency-based teaching, but faculty express some concerns about maintaining rigor, workload, and accreditation expectations. So which instructional decision is going to best reflect a true shift to competency-based teaching and explain why fundamentally it will change learning outcomes? So we have 3 options. A is redesign courses to ensure all required content is delivered with increased opportunities for student participation. B, align assessments to demonstrate clinical judgment across context, regardless of time spent or content exposure. Or C, expand simulation and active learning activities while maintaining existing grading structures and course timelines. All right, so I'll give you all a few moments to think about what the best answer is based on these 3 options. And I want you to also think about your rationale for the other 2 options not being correct. Okay, so you want to think about your rationale for the correct option and the incorrect option. I'm going to leave it large for those that are watching this snapshot. I want you to just have a chance to really process the words on the screen. And for those of you that are like me, you're a processor, then it may take you a little more time. You can feel free to pause this snapshot and come back. All right, so if you chose B, give yourself a round of applause. You are correct. Aligning assessments to demonstrate clinical judgment across context, regardless of time spent or content exposure, is going to be the best response that most closely aligns with the rationale and the evidence that supports shifting to competency-based teaching. When we talk about student readiness and their ability to make those safe patient care decisions, it requires us to truly partner with our students on the journey. So what that means is we have to think about where their gaps are, how can we best support their gaps, and what specific strategies can we bring into the classroom to help them go deeper and for us to go deeper in validating their knowledge. Socratic questioning is a great strategy to use as well. So maybe we'll talk about that one in a future snapshot as well. Well, thank you all for joining us for this snapshot. We are excited that you're joining us. Make sure you subscribe. That's how we stay here on YouTube, and that's how we know that you're interested in this information is valuable. We look forward to seeing you in the next snapshot. Have a great one, everybody.